Hello and welcome to the CDO Magazine interview series. I'm Maria Espona with ArgIQ, and we are partnering with CDO Magazine, MIT CDO, and the International Society of Chief Data Officers for a series of interviews. Today, we have the pleasure of talking with Dr. Rayid Ghani from the Carnegie Mellon Institute. Welcome, Professor.
Thank you. Thanks.
I have a question, but related to my research, because on my research interested is disease surveillance and biological weapons. And I designed a model that includes gathering massive amount of open source data to create an early warning system. And do you think it's possible to use machine learning techniques to get a prediction using this data?
I mean, it's one of those things where in theory, yes, right? It depends. I think like when we work on sort of disease surveillance or disease prediction systems with public health agencies or with hospital systems, of course, it's possible to, like a lot of machine learning methods are designed to be really good at prediction tasks. That's kind of that's not the only thing they can do, but that's one area where machine learning has had a pretty long focus on how do we make predictions better. Now the question becomes, there is no such, if you sort of say, I want to do predict the what's going to happen, all the millions of people who are doing random lines for COVID predictions, right? Anybody can do that. Can they do it well? Does it change anything? Does it help? I think those are the questions that when we're working on a project like this, the question becomes, yes, we can use machine learning to predict things. Is that better than other methods? No. How do you know that it's actually robust and accurate? What actions are you trying to inform? If the prediction is just there to predict and nothing happens with it, what's the point? If you're trying to allocate vaccination resources based on those predictions, how early do you need to know in order to allocate vaccines? If you're doing it to even figure out how many vaccines to produce in different parts of the world to transport them, and if you need 6-month warning, then the prediction needs to be 6 months early. Well, if it's 6 months early, how accurate can it be so that it can inform, the action? So I think, often when people think about machine learning or prediction, they sort of will say, oh, I want to build a system that predicts HIV or COVID or predicts the flu. There is no such generic system, right? It's, I want to build a system that can help me allocate vaccination resources in order to increase the equity of health outcomes for people. Like that system can have a component that says, okay, I need one component to figure out the prediction task needs to predict which were the people at risk, of, let's say, HIV, and how early do I need to make the prediction? How many people do I need to identify? And what are my resources? How effective are those vaccinations for different types of people? So I think in our minds, like the goal is to solve a larger problem, of which the prediction is a small component, of which machine learning is one tool you use to build it. It's not the only tool. It's one of many tools you use. And it's one of many, many disciplines. So I think in our, at least when we work on these projects, we bring in people from students, from computer science, from statistics, from math, from econ, from policy, from sociology, from psychology, political science, engineering, because all of those disciplines are needed to build these systems. It's not a machine learning expert generating predictions in a corner. Everybody needs to be. So I think yes, machine learning helps, and it often helps do things at these types of prediction tasks better. But those problems and systems need to be designed, very deliberately, very carefully formulated the way to solve that specific problem to support the different programs you're trying to run, as opposed to this magic module that, like, here we go, use this machine learning system to predict whatever you want, which often a lot of organizations think of it that way. It's this magic thing. But we know that there is no such thing.
We know this is not the way. Yeah. It was when I designed this model, what I was thinking is if when you have an outbreak of a disease, you have several conditions that you can check. So maybe when you have the next outbreak, if some of the conditions start to appear suddenly or progressively, you can see that you might have an event, maybe not, but I believe that could help to, it's not prediction that in 20 days we will have X amount of people sick, but something that helps to, at least to prepare the healthcare system to, to cope with.
Yeah, if you sort of predict that in the next 1 month, the hospital system will be overloaded. So you're basically using it to figure out, do you have enough bed capacity, or do you need to coordinate and from other hospitals nearby and get additional resources and get ready. And then the question becomes, right, is how early and how accurate? Because the later you get, like for tomorrow, I can be very accurate, but I can't get more beds between today and tomorrow. 6 months early, I can get beds, but I'm not going to be accurate enough. So I think that's one problem with the Johnson County project that you were mentioning. That was, we spent a lot of time trying to figure out in the first phase of that project, we were trying to predict which people are likely to be booked into jail, but their need is mental health needs. They need mental health services, and we need to provide them proactively. But the system has to be accurate enough that if all the people we identify, only 10% of them were likely to have mental health needs and go to jail, then the intervention is not useful enough because it's not accurate enough. But it also needs to be early enough, right? So in a different project we were doing on diabetes, preventing diabetes, the doctors wanted to know 3 years early whether somebody is at risk of developing diabetes, because they said it will take us 3 years to work with a patient to change their lifestyle behavior to prevent it. Otherwise, if you tell us a year early, we can't do anything. It's not going to stop the disease from happening. We need to know early enough. But the earlier you know, the more resources you're going to waste on. That's not accurate. You're going to say that person is at risk. Maybe they're not. So that tension, it's not a machine learning question, right? It's a policy question of what resources do you have? How can you allocate them based on your policy goal? And that those questions can need to be thought of upfront before you build the system.
And I think what you just mentioned in the different examples shows that either medicines or social problems are not something that can be solved with mathematical equations, that you can say exactly this will be the same next year and the other, and we will have the same problems all the time, that it changes. So you can, your accuracy, it's also related to the kind of problems. It's not that you are working only with numbers that are related to nothing in reality.
Exactly. It's exactly that is accuracy. And even as in a lot of people, when they're working on a lot of the projects or classes or courses, they teach students how to do generic, like build a model and evaluate its accuracy. What does it mean? What does accuracy even mean? Right? If you're using this, as you said, if you're using this model to figure out, do I have enough capacity in the hospital? Then you want this model to be accurate to tell you if you're under or over capacity. Whether you're a little bit off, under, or over, it doesn't matter. As long as if you tell them you have enough capacity and then you're wrong, that's a bigger, so it's not the traditional, a generic accuracy metric. Or if we're using, again, in the case of Los Angeles, for example, they wanted a list, they thought we could intervene with about 150 people a month. So we have to give them the 150 people, and we want to be as accurate and equitable as possible in that list of 150. So then you have to construct a metric that matches the use case. And then the system you build has to do well on that metric, not on specificity or sensitivity or accuracy or C-statistic or AUC or precision or recall, it's because those are fine as generic metrics, but in order for the system to do well, it needs to. So that's one important part of the training, is taking the problem, talking to the people who are going to use the system to figure out what is the evaluation metric, so that you design the models to improve that metric rather than a generic accuracy metric that may have no correlation with the actual metric you care about.
So thank you so much, Rayid, for this interview. I really enjoyed it. I learned even a lot. So thank you very much.
Yeah, this was great. Thanks for the conversation.
Thank you.